Ebola crisis sparks debate over global health double standards. The World Health Organization, WHO, has reported a significant rise in Ebola cases, with the latest figures indicating 600 confirmed cases and 139 suspected deaths. This alarming situation has reignited discussions regarding global health responses and the perceived double standards that exist in addressing health crises across different regions. The current outbreak, which has drawn attention due to its rapid spread, raises questions about the adequacy of international health measures. Experts argue that the response to the Ebola crisis highlights stark contrasts in how health emergencies are managed based on geographical location and economic status. Historically, outbreaks of diseases such as Ebola have often been met with varying levels of urgency and resource allocation depending on the affected region. For instance, the international response to the Ebola outbreak in West Africa between 2014 and 2016 involved significant global mobilization, leading to the establishment of emergency response protocols and the deployment of international aid. However, critics argue that the same level of urgency has not been afforded to outbreaks in regions that lack similar visibility or political clout. As the current outbreak continues to escalate, concerns have been raised about the availability of vaccines and treatments. The WHO has warned that the development of an effective Ebola vaccine could take up to 9 months. This timeline has sparked fears about the potential for the virus to spread further, especially in areas with limited healthcare infrastructure. Health officials have emphasized the need for countries to bolster their health systems to manage such outbreaks effectively. The WHO has called for increased funding and support for health initiatives in regions that are often overlooked during health emergencies. The disparity in health resources allocated to different countries has prompted a broader discussion about equity in global health. In light of the ongoing crisis, some international organizations and health advocates have begun to mobilize resources to aid in the response. Initiatives are being launched to accelerate vaccine development and distribution, with a focus on ensuring that affected regions receive adequate support. However, the challenges remain significant, as logistical issues and funding gaps continue to hinder swift action. The debate over global health double standards has also extended to discussions about the role of pharmaceutical companies and their responsibilities in addressing health crises. Critics argue that profit motives often dictate the availability of treatments and vaccines, disproportionately affecting low-income countries that cannot afford high prices. In response to these concerns, some governments and non-governmental organizations have begun advocating for a more equitable approach to vaccine distribution, emphasizing the importance of prioritizing access for vulnerable populations. This call for action has gained momentum as the death toll from the current Ebola outbreak continues to rise. As the situation develops, the international community is being urged to reflect on its commitment to global health equity. The ongoing Ebola crisis serves as a stark reminder of the critical need for a coordinated global response to health emergencies, regardless of where they occur. The implications of the current outbreak extend beyond immediate health concerns, touching on broader issues of social justice and equity in healthcare. The WHO's latest updates indicate that the situation remains fluid, with health officials continuously monitoring the outbreak and adjusting their response strategies as necessary. The urgency of the situation has prompted calls for a renewed focus on strengthening health systems worldwide, ensuring that all countries are better prepared for future health emergencies. As the world grapples with the implications of the Ebola outbreak, the conversations surrounding global health standards and equity are likely to intensify. The outcomes of this crisis may have lasting impacts on how future health emergencies are approached and managed, highlighting the necessity for a unified global health strategy that prioritizes the needs of all populations, regardless of their geographic or economic status.